Well, the sleeve gastrectomy is one of several bariatric operations, one of several options that we have available to treat people with obesity. And I actually started calling it the takeaway operation, in a sense, comparing it to many of the others, like the band and the bypass. Because after a sleeve gastrectomy, once the patients are over the difficult initial few weeks, provided they comply, provided they take their vitamin and mineral supplementation, really it's very low maintenance. There's very little else required. For the band, you need adjustments. For the bypass, there's always the risk of small bowel obstruction. You need to be extra attentive to the vitamin and mineral supplementation. But with the sleeve, as I say, a bit of a takeaway in the sense that patients can go away and get on with their lives. And that is my overriding priority, is to get people back to normal so they can actually live full active lives with good function, eating meals, enjoying food with family and friends. And that really is sometimes forgotten. We're a long way from the days where people's jaws were wired in order to help them lose weight. And the idea with the sleeve is to get you to normality and get you back into society, interacting, back into activities. So after a sleeve, essentially, you will eat less and you will lose weight. The operation itself takes about an hour and a half with belts and braces. As I say, we don't cut any corners in it. We really do tailor it, and we allocate a good time slot for the surgery. There's absolutely zero pressure in terms of time and lists. And the patients stay 24 hours. If they're young, fit, very straightforward. Sometimes patients, or the older patients, or people who have other risk factors, sometimes stay a second day. And so it's 2 days in hospital. After they go home, they gradually build up over days onto a soft diet and then a more solid diet. And they're generally, by about 2 weeks to 4 weeks, they are beginning to take a solid diet more comfortably. So people have started drinking straight away. On the evening of surgery, we give people a cup of tea or some juice or something to drink straight away. And the energy levels generally are low for the first month because the intake is about, or usually less than 1,000 calories a day. And people do feel quite weak. But after about a month, the energy levels recover. And generally by 3 months post-op, people's energy levels are higher than they were before they actually came to me in the first place with their weight issue. So the total convalescence is a few weeks, actually to get better than you were, your preoperative state, 2 to 3 months. One of the things that I warn everyone about with the sleeve gastrectomy is the risk of reflux. And anyone who comes to me gets asked about how much reflux they get, how much heartburn. And that is probably, I would say, the most common side effect. It's very easily managed. Usually it settles. And very, very occasionally, very, very rarely, if it doesn't, there are other relatively straightforward procedures to address it. In fact, I put the first links on a sleeve gastrectomy in the United Kingdom about 6 years ago. But that is at the extreme end. It's extremely, extremely uncommon for the reflux to be that bad. And in fact, over the last decade, there are various tricks that you can use during the operation, if you're a bit attentive to the little details, that actually significantly reduce the risk of reflux. So the vast majority, I'd say 80% plus of my patients post-sleeve, probably about 90%, don't need any acid suppressing medication at all. They don't get reflux to the extent that they need a meprazole or Losec or anything. It might be 1 out of 10 at the moment who's getting that, but I nevertheless always warn everyone about the risk of that possibly happening. The overriding thing, obviously, is safety with anything. You don't want any intervention where the risk outweighs the benefit. In terms of the mid and long-term objective, it's about returning people to a good quality of life and a good function. And my focus from the get-go, from when I first meet someone, from the first day, first minutes in the clinic, is how badly is their weight affecting their everyday life? Is it stopping them going to the gym? Is it preventing them socializing? If they're young, is it preventing them forming and developing relationships, even attending college education? If they're older, it's about mobility quite often. And often you get parents, grandparents who cannot enjoy their young children or grandchildren, and because they're completely immobilized by their excess weight. So my priority long-term is to get them back to that function. And when you can get 60% of the excess weight off, and people can get back to that, it's about returning to normality. With eating, again, I want people after a sleeve gastrectomy to be eating 3 meals with friends and family, enjoying the food, just a significantly lower volume of food, and a healthier, more balanced diet, because invariably as people see the results, their motivation gets reinforced and they work harder and try harder at selecting better food, and the food choices improve, the food quantity goes down. And that's, I guess, sums up the long-term objective.